Sam, Trouble,
That's me.
how are you? How's the East Coast? Warm?
It's
Warning
good.
about
It's warm until we get hit by a hurricane, they're saying next week. So we'll see you Thursday actually this week.
Good morning. Good morning.
yeah. Good morning. Nice to meet you.
Nice meeting you. Hi, Sam. How are you?
Hi, Dr. Ziad. Good. How are you?
So
Fine.
where are you in the world, Dr. Ziad?
I'm in Beirut, Lebanon. And right now, just let me, it's very heated here. Let me take it from there.
We were talking about the weather, but I can imagine that. Yeah.
No, I'm not talking about the weather.
Oh, you are? It could go both way, weather or something else.
Yeah, no,
Yeah,
hopefully neither or. So what time is there at the moment?
it's 6:25 a.m.
6:25 a.m. I've never been in Lebanon, but my one of my old girlfriend's grandfather was from Lebanon, and her dad used to cook Lebanese food every Sunday, and it was amazing. Yeah, yeah, it's a massive influence. It's a massive, but not a massive, but there's a lot of families, Lebanese families in Mexico, so they have a really good restaurants, really good Lebanese restaurants there. So
Okay, yeah.
that's my only experience with Lebanon. So
Nice.
pretty good.
It's the best experience. The food is the best.
Yeah,
Yeah, the food is the best. Yeah.
this is really good. Yeah, and I have a client here from Lebanon in Wellington, and he gets twice a year sweets from Lebanon, so stock up
Oh, yeah.
for half a year. And I was there once when he got a whole delivery for it. And I'm like, are you putting a candy shop or something? Like, what is all this? Now this for 6 months till I get all sorted. And I got some bites, out of it
Yeah.
to get me through the week, which is also was very pleasant. So
It's yeah, it's we're very well known about food, sweets, and all these things. I mean, you have to visit. I think the best thing you can ask Sam, you have to visit.
I will. I love to go. It's a mystery for me that part of the world,
Yeah.
and I love to. I love to go there. So, but anyway,
Yeah, I will.
well,
I'm looking forward to hopefully visit one day. We'll see. We'll see.
yeah. You can excuse that on a work trip, Sam.
Sure.
Yeah, you can excuse that. Go and research.
Yeah, I'll talk to Mark.
Yeah, thank you for that.
I'll get him. I'll get him into it. I'll convince him. It's easy.
Easy. Thank you. Hey, okay, so let's just get on with it. So what we normally do, I just do a little wrap it up, and I will introduce you. So I have you a short CV over here.
Okay.
And do you want me to introduce you Dr. Ziad or you Dr. Salameh? Salameh?
Salami. It's a
Salameh?
salami. Yeah.
Dr. Salameh or just Ziad? It's up to you.
Ziad
Or
is good.
Ziad. You can use
Ziad is
whatever
easy.
you want.
Okay, perfect. Thank you.
Ziad is easy.
And we got a few registers for the course, but obviously this is 3:30 in the afternoon, so we're taking advantage that they actually this month is very quiet in the practices. So it's been you go to the practice and people are floating around. So
Okay.
we got a really good response on registrations on because people then had really book.
How many?
Fortunately,
How many do we
I think
have?
it's
You think?
around 20 people that we got.
Good. Okay.
So, but anyway, what will always happen is, people register and they can't come in or, one way or another. So we
Sure.
normally do we edit it and we record it and we send the
Yeah.
record with a little, the product information with a little deal, etc. So, so yeah, that's what we normally do. So I have the presentation here. So Ziad, you can just tell me when is next or not next, or if you prefer to
Uh,
actually
I I'll tell you one thing. This is one of my things. I always edit my presentation. So the presentation I have now is 2-3 slides different than
Perfect.
the one you have.
So what I'll do is
And
I'll
I
make
prefer to control it.
perfect. So what I'll do is I'll make you host once I get everybody in, and then I will you can just do it the way that you are. All right.
Yeah, it's I prefer that if possible.
Cool. And I was recording already. Okay, it's fine. So it's all good. All right. Well, let's just kick in then. So we'll just get it going. I'm gonna let everybody in first. So yeah. Yep. Done. Perfect. Okay. Well, I'm sure other people will join, on the go, but here we go. Okay. So I'll start. Where's the view? Sorry, I'm just trying to get myself here. Done. Right. Well, good afternoon, everyone, and thank you for joining us for another DENTACHAT by Alluro. We're in Auckland today, 3:30, 24th of September, and we experienced a beautiful spring day. So we kick spring in the beginning of the month, and we having these beautiful sunny and warm days across this week. To be honest, the other weeks haven't been that great. But yeah, so wherever you're joining us from in the country, I really hope that the sun is shining as well as here in Auckland. Today we are is joining us Dr. Ziad all the way from Lebanon, and also Sam that you have met before if you watched the latest DENTACHAT a few years back. I think it was probably 3 years ago. I think so. Yeah, so pretty much we join in continents from the States to the Middle East to Oceania and the bottom of the Pacific. So thank you for that. Well, Dr. Ziad, not only a dentist, but also a master in prosthodontist and a PhD in biomaterials, a professor in Lebanon or in the University of Lebanese University, is it? Yeah. And also a visitor of the university in Italy in Siena. So today we're here to talk about hypersensitivity. And for most of the people, I'm sure will be familiar with that. But some people actually don't know. And we assume that, using a sensitive toothpaste will cure and it will somehow resolve. But we're here to talk more about why is it cause and how can you deal with that, and especially our special product that we have that is instant fantastic. So no more introduction. Thank you so much for joining us. Ziad, I'll pass it on to you, and we can start. We can get going. So just a second. Done. Yes. Cool. So now you can share your presentation now. So yeah. You
just one moment. I'm granting access.
Yeah.
Okay. Okay. So that's it.
Perfect.
just, yeah. So, good morning, good evening, good afternoon. You know, we are just discussing on 3 points, different time frame. I would like to thank, of course, the Aluro Healthcare for their invitation. Thanking, of course, Denmat, Sam, for the very nice invitation as well. Today, we'll be discussing the management of dental hypersensitivity. I don't have to go in introducing myself. Thank you very much for the kind introduction. Jumping directly to our content for the day. So what are we witnessing today? We're just witnessing a novel dental world. So a shift in the dental, a paradigm shift. So if I want just to go fast and divide dentistry into like a Netflix movie into 3 episodes. A first episode that mainly we all know, you know, the first episode, we went through all of us, till 2008, 2009, in which digital started coming inside dentistry. And remember the digital smile design and so, up till 2018, 19, in which another digital revolution came, and this is called the 3D era. So what have changed from the first episode till present? Of course, basics still the same. Only technology came and just pushed dentistry and all medical sciences, dentistry, medicine, pharmacy, toward a new era. This has pushed also a lot of companies to start developing a lot of products, a lot of technology, a lot of equipments. So it's also because of the aesthetic social revolution that happened, pushing again dentistry to what is called the aesthetic dentistry, because simply smile is in the middle of the face and plays a major role in defining aesthetics. So from the very famous Hollywood smile that we all know, just going to all social media and seeing that all these things are moving forward technically into just aesthetic things. So in the era of digital dentistry, again, it's just, and remember, I am the director of the digital dentistry platform at the university. It's just an upgraded dentistry. It's like dentistry 4.0 with all the different parameters from the acquisition to the design to the manufacturing. So dentistry in a nutshell, digital dentistry is just, you know, tools, equipment, knowledge, software, and in one slide, you can see this is technically the digital workflow. So it's not, of course, the subject of our talk today. And some of you are still asking themselves, we're not here for digital dentistry, but just to start, you know, like some James Bond movies, from some place to move to another place. And again, back to basics. So even with all the modern technology, all what is happening, let's go to basics. What are the basics, or what is the basics, or who is the basic? So we are just dealing in our daily clinical practice every day with one person or patient. So the center, again, of the treatment is the patient. It's the patient mainly that will come to us, even if today more pushed, more motivated by aesthetics or function, but still the number one reason, the number one bringing people and patient to our office is pain. And pain can be, again, multifactorial, can be due to several factors, but today we're just trying to unveil together what is called tooth sensitivity, or dentin hypersensitivity. So what is dentin hypersensitivity? As again, published, I'm a researcher again at the end, I'm directing the research center. So my mind always worked with an evidence-based dentistry combined with a clinical significance and outcome. So sensitivity is simply when dentin is no longer layered with enamel and becomes exposed to stimulus. This is where we have the hypersensitivity or the sensitivity. And this very nice systematic review paper published reported that an average of 33.5% of hypersensitivity, of dentin hypersensitivity, is reported when with patients that will affect and is affecting the quality of life of our patients. So what are the different theories behind dentin hypersensitivity? 3 theories. The first one, which is a direct neural simulation. The second one, odontoblast deformation or simulation theory. And the third one, the hydrodynamic theory. Let's go through them very quick. And the first theory, which is the direct neural simulation, so they're assuming that pain is caused by direct simulation of some odontoblast extending of the pulp, but technically this theory is not backed, so technically this is rejected. The second theory is the odontoblast simulation or deformation theory, suggests that odontoblast can function as receptors, but in this case, it requires the creation of new junction. Even again, this theory is largely rejected with no evidence. So again, this is rejected. And this takes us to the third theory, what is called the hydrodynamic theory, suggesting that pain arises due to stimulus. And this stimulus will create a fluid flow inside the dentinal tubule that will trigger the pulpal nerve. And this theory is an evidence-based one, is scientifically approved. So if we go again to the mechanism of the transmission of pain, so it starts again with a stimulus that will create fluid that flow in the exposed open dentinal tubules. This will simulate the AS fibers and will trigger pain. So simply, this is the scheme of the pain transmission. So how it feels, we have short, sharp pain on the affected teeth that is triggered with hot food or beverage, cold food or beverage, ice cream, soda, etc., sweets, and sometimes while brushing, especially for the people that brush very hard. Is dentin hypersensitivity related to dental procedure and dental treatment? Yes, we can see it, and you can see it in your daily clinical practice, especially with bleaching procedures in office or at home. It can be observed with some restorative procedure, like when you are doing some resin composite filling, class 2 cavities or deep cavities, when we're doing laminate veneers, upper, lower, or some full crown restorations. Observed as well, and a lot of time after scaling and root planning, especially if the cementum is exposed. And sometimes this dentin hypersensitivity, even a lot of time, is not related to dental treatment. Related to some people with erosions, they have a lot of reflux or bruxism, abfraction, and you can see it on the teeth. So again, this problem that is multifactorial needs management. So how to treat dentin hypersensitivity? How to manage dentin hypersensitivity? Evidence-based, again, showed that the way to treat it is by desensitization and occluding the dentinal tubule. This is the way. So by this way, again, you see on the market a lot of brands, a lot of gel, a lot of toothpaste that are, again, claiming the treatment of dentin hypersensitivity. But again, the evidence showed that this aim of occluding the dentinal tubule is achieved by using calcium phosphates. You know, the calcium phosphate that can have different type of ions like Bioglass, tricalcium phosphate, dicalcium phosphate, tetracalcium phosphate, nano-hydroxyapatite, and mainly the amorphous calcium phosphate that is interesting us today. So this calcium phosphate, no doubt, research showed that has the properties to reduce the pain related associated to dentin hypersensitivity. So the amorphous calcium phosphate, or ACP, is a metastable phosphate. So it's like an intermediate phase of other phosphate, such as hydroxyapatite and the OCP. So we have dentin hypersensitivity. We have a lot of products on the markets. But again, we are experiencing daily patients to whom we prescribe all these material or this gel or this toothpaste. But again, they will come up again and say, doctor, we used it. It's a little bit better, but still my dentin hypersensitivity is there. So what is the solution? And you know, when we ask such a question, we have to ask another question that the patient will asking you, and then what after my pain? What to do to resolve my pain? So, and then we move to then. And this then is the Zen CP+, which is the desensitizing gel, and in which we will go a little bit in depth today in discussion. So effectively, it was engineered by DENMAT from the US using an innovative microscopic technology featuring very small particle with an average of 200 nanometer, consisting of amorphous calcium magnesium phosphate. So it's the ACP with magnesium incorporated in. So with the Zen CP+, the mechanism is with very small particles. They will go fast, deep inside the dentinal tubule, and then will be observing mineralization and occluding of the dentin surface, but not only the dentin surface, again, deep inside the dentinal tubule. Remember, the problem is coming from this hydrodynamic theory. It means the move inside the dentinal tubule, and our objective is just to block and occlude these dentinal tubules. So what is observed with Zen CP+ is a deep penetration of these ions that will go up to 30 micrometer. And mostly we have a thickness of the occlusion layer, you know, of the plug at the surface that is around 2.5 micrometer, which is a very significant one. So again, if we observe at the research level, these microphotographs from scanning electronic microscopy, and you can see the ACMP in the middle, and it shows that we have a very good occluding behavior. You see on the surface, it's completely occluded, and even we have the formation of crystals in the intratubular dentin along the tubular length as well, and we'll see it in a while. So again, when Zen CP+ is used, there is a formation of fibrils into a 3D network in the intratubular dentin and adhesion and the peritubular dentin, so along the dentinal tubules. So as a result, we have a complete occlusion plug at the surface with a thickness of 2.5 micrometer, very deep penetration, and this is very important, within the dentinal tubule that can go up to 30 micrometer, and the formation of intratubular hydroxyapatite-like crystals along the dentinal tubules. So the result, we have a strong interface by formation of collagen fibrils in a 3D network in the intratubular dentin with adhesion around the peritubular dentin. So this showed that we have an occlusion from the surface down to the dentinal tubules. So how it starts, when it's applied immediately and within 5 minutes, the pH will move up to 9.5. This will release the ions that will create a buffer solution, and this enables tooth mineralization by again promoting hydroxyapatite deposition. So this is the mechanism. This is what is happening when we apply then CP+. So why magnesium was incorporated in the formulation, in the amorphous formulation? Because it will secure a continuous release of calcium instead of a quick burst. And this will help in a continuous, and this is very important, mineralization that will go up to 1 week, up to 7 days. So this is why magnesium was incorporated. So we'll have a better, a more sustainable result over time, because this is what is needed. Not just to apply a gel, having some results, and 48 hours, 72 hours later, things will drop down. So with then CP+, this is not observed. Reversely, we have a very good results over time. So again, anything I'm discussing, I'm talking about is published. It's evidence-based, as you can see. And the question is, for us dentists or for patients that will ask themselves after, why me, not you, mean why then CP+, why choosing then CP+, why prescribing then CP+ to our patients? So again, as a researcher, you know, I like to search for the evidence. I like to see the real results. So let's go and try to compare the outcome of Zen CP+ to other brand, to other material, to other toothpaste, to other gel that are on the market. And I think you know them all. So you see on the first left row, you see the Zen CP+, and these are scanning electronic microscope, microphotograph. So the Zen CP+ showed a full occlusion on the surface, if you see, after application of the dentinal tubules. So this is on the surface comparison compared to the other very known brands like Sensodyne, Colgate, Enamelon, Oral-B, MI Paste Plus. We'll see it in more details in a while. Even if we go to a cross-section comparison, mean looking in the dentinal tubules, we see that we have a formation of a very well integrated and highly crystalline minerals deep inside the dentinal tubules. This is what is needed, surface and inside the dentinal tubules. So we have created this table just to show you a little bit. This is a comparative table between the Zen CP+ and the other known brands. And we divide it into surface occlusion, penetration, the depth, and integration. And just by looking at them, we can see, and we'll develop it in a while, that the use of Zen CP+ will have a significant better result when compared to others. So, you know, if you want to challenge this product, this gel, is challenging it by placing it with acid. It means after 7 days of application, citric acid of 2% was placed just to see the behavior of the result, the outcome result out of applying the product, and to see what's happening. So starting by the control, which is the Zen CP+, is showing effectively then after challenging with acid, only a partial removal of the occlusal layer was observed. while the minerals inside the tubules stayed the same. There was no effect, and this is very important, on the mineralized deep inside the dentinal tubule. So this is for the Zen CP+. So let's compare this with the other product that are again placed in the same condition, 7 days, then applying citric acid 2% for 30 seconds. Let's start with the famous Sensodyne. So with Sensodyne, the results showed that the acid has dissolved the minerals and the tubules are exposed again. So this acid that you can find in the mouth all over, especially people with a reflux, acidic reflux. So after placing this product, we will have dissolving, the minerals will be dissolved and the dentinal exposed. So again, post-op sensitivity and dentin hypersensitivity will be observed again. Moving to the other product, the Colgate Sensitive Pro Relief that you all know. Again, this time it was very heavily affected and all the dentinal tubule was heavily and completely exposed after challenging with acid. Remember, we're just comparing these different products with the Zen CP+ that we showed at the beginning as our control group. So with Oral-B, you know, the third one, the Oral-B Pro Expert, again, at the initial phase, there will not a full occlusion inside the dentinal tubules. Now, the change is there, not significant like the two previous, but again, they lost minerals. Moving to the GC, the well-known one, you know, the MI Paste Plus, again, after placing it into acid, there is minerals, particles has dissolved, and the tubules are again exposed. So starting from a pseudo closure up to opening after placing it into acid. So moving more with other products like the enamelon, if you can see, they use the ACP technology, but it's not the same formulation. It's not the same microscopic investigation, not the same microscopic technology, and not integrating magnesium. So again, in this situation, scanning electronic microscopy showed that there was dissolving of the mineral, and again, the dentinal tubule were largely exposed. Mean, again, exposed for dentin hypersensitivity. So this is what we were talking about. This is why magnesium was incorporated in the ACP formula, to again have a continuous mineralization and to assure a sustainable result of the Zen CP+. With the final product that we are comparing to is the SensiVital Plus, you know, from gum. Again, dissolving of the mineral on the surface, as we can see after the acid etching, and things will drop down again. So after this comparison with different brands, different products that are on the market, and which dentists were used, and a lot of dentists don't know exactly the formulation, but you know, we're just used to just give this. So showed that effectively we need to understand the mechanism and to ensure sustainability of our result. So what is the outcome of the Zen CP+? Again, as we say, it was resistant to the challenging of acid. And this is where, you know, in the saliva, it's the acidic environment that will kill everything. This is our problem as dentists, and especially if we're applying some gel. So the resistance here is not just to the particle, but it's because of this highly well done and integrated minerals, you know, in 3D as we showed it at the surface and inside the tubules. This occlusion that happened after using Zen CP+. So is Zen CP Plus safe? Yes, it is safe. Does not contain any milk-derived protein because, you know, some incidents were reported with other products in the US. It's a gluten-free. It has a low abrasion formula, so it will not harm enamel surface and can be prescribed or used with patients that are 18 years old or older. So how and when? Effectively, it can be used twice a day for 3 weeks or more even if it's needed. When can be used? It can be used at a prophylaxis basis before dental treatment if you want. For people that have erosion, bruxism, abfraction, it can be used. It can be used before or after bleaching procedures as well, after scaling as well. So it can be used before or after as a treatment or in prophylaxis. It can be used in combination with fluoride toothpaste. There is no single problem as well. So again, Zen CP Plus is there and will help you because it will ensure sustainability over time. And trust me, patients will be very happy. So today, it's about aesthetic dentistry. Everybody is crazy about aesthetic dentistry. We understand, you know, all social media, you can find all this type of photos. But remember one thing, that aesthetic achieved means just boosting and giving patient their self-esteem. But if pain exists and non-treated like Dentine Hypersensitivity, we will never achieve the ultimate goal with our patients and having a better quality of life for our patient and seeing them smiling. So I would like to thank you very much for your time. And I hope you enjoyed a little bit this information about Zen CP Plus. Thank you very much.
Thank you very much, Dr. Ziad. That was very good. I do have a couple of questions. Just so, you know, when you say that, so basically, to put it on non-medical, not doctor terms, so it is similar to other products. The main advantage is because it's such a small particles, they can go faster and deeper. So that instead of working as a topical as most of them, they work from the inside to the outside. Is that more or less okay?
Yeah.
Okay.
Exactly. Yeah, go ahead, sorry.
And no, and the other thing is, I was going to say is the combination with magnesium, which I understand is unique compared to any other products, it makes it also more stable because, as we know, the calcium phosphate is unstable, you know, and that's why other companies try to mix it with something else to make it more stable. So the magnesium makes it more stable, and the formula to be so small, it goes deeper on the tubules to work on the inside and the outside, and that's why it works very fast.
Exactly.
Right. So
Zen CP Plus.
Sorry, yeah.
Go ahead. So I'll answer everything. Yeah.
No, that's it. Yeah, that's it.
So effectively, you know, the very nice development with Zen CP Plus is the technology that was used first. It means this microscopic, the caposal, you know, the technology that was used that is behind the development when Denmat developed Zen CP Plus, using this technology, so having very small particles, okay, that will go deep. You see the 30 micrometer going very deep inside the dentin tubule. It's not about only closing the surface, which a lot of other brands just work on the surface. This is one. The second thing, the presence of magnesium that will ensure, again, a continuous mineralization. It's not just a burst, but it's a continuous process that will assure sustainable result. What we need is sustainable result, not only a burst, not only, you know, having this adjustment for 1 day, 2 days, but with Zen CP Plus, with this new technology, with the magnesium incorporated, the small particles, we have resolved the state because you have an occluding, we have an occlusion of the full length of the dentinal tubules and on the surface.
Okay, yeah, gotcha. The other thing is obviously when you're doing very common, so just for everybody here, that my paste, we know it here as a tooth mousse. So in Australia, New Zealand, it's called a tooth mousse and tooth mousse plus. Like that's the GC product. In the rest of the world, it's called my paste. So when it's very common here in New Zealand, and they're doing whitening, they put a tooth mousse along with it. So obviously you can do sensitive gloss as well as part of the treatment now.
Yeah.
Yeah. Okay.
Yeah. Because again, it can be, and this is one of the projects, one of my students like it now, start preparing it, but we did some piloting. It's playing on two levels, one prophylaxis level before bleaching and after bleaching. So using it, there is no single interference with that. But again, the Zen CP Plus, the nice thing, can be used at two different levels. It means prophylaxis and treatment. And this will ensure a drop down of any dentin hypersensitivity.
Sorry.
So the thing is, again, dentists, we have to change our way of thinking and approach. So it's just prescribing Zen CP Plus as a prophylaxis before moving to a dental procedure, and again after dental procedure. So we are covering, we are covered by occluding all these dentinal tubules and just avoiding dentin hypersensitivity. And if it's there, treating it.
Now, the other thing is on tooth mousse is that the calcium that they use in it comes from, is a milk-based calcium. And there's some people who have allergies on that. So how's this compared to the Sensipi Plus?
It's, there is no protein, no derived milk there. There is gluten-free, so we don't have any effect. So people that have allergy or anything are totally safe for that. Totally.
Perfect. On to it. I know we passed the half an hour already, but I just want to say thank you so much, Dr. Ziad, for joining us this morning from Lebanon. As I say just before that, I am a big fan of Lebanese food, and hopefully one day you come down here and we'll show you around. I might say, I'm not from New Zealand, so New Zealand, you don't come here for the food though. You come here for the exploring, and I can see you like hiking. So this is the good country to go hiking.
Thank you very much. It was a pleasure. I would like again to thank Alura for the invitation. Thanking a lot Denmat, congratulating them for this beautiful product. It's really amazing. And I hope to see you all very soon. Sam, thank you very much.
Thank you. Thanks, everybody. Thank you.
Yeah, that's great. For those ones listening, the CPD point is 651135.
Okay.
And we'll catch up anytime soon, I'm sure. And we'll see you guys next time in another dental chat. We will email this with the CPD point and everything you need to know about Sensipi and flavors in the packaging, price, and all that. But not saying any more. Good afternoon from New Zealand, and we'll talk soon.